There is more bad news when it comes to America's healthcare system, and the progressives could not be happier about it. According to a new report from the Commonwealth Fund that surveyed the health systems of 11 industrialized nations, we ranked dead last. Even though the U.S. spends the most per capita on care, the study found that the United Kingdom was the best, partly because it's a single-payer national health service that apparently costs less than half as much as the U.S. The survey compared over 80 categories of care like quality, cost, efficiency, and even access to doctors, and relied on the data from the Organization for Economic and Cooperation and Development, along with interviews from physicians and patients to rank the countries. Now, the progressives aren't just happy the report was done prior to Obamacare kicking a no, because now they can and will use it as a stepping stone to move us to single payer. Sounds scary, but here's the thing. These rankings are based on aggregate statistics and don't tell the whole story. For example, I don't know if you heard this one, a British man who cut himself to the bone with a chainsaw had to go to 3 different hospitals before receiving the care that he needed. And apparently, that's not an isolated incident either. That kind of stuff happens all the time in the so-called best healthcare system in the world. Joining me now to give this survey a little bit more perspective is healthcare analyst Dr. David Hochberg from the National Center for Public Policy Research. Here's what's driving me nuts about this. I was on the World Health Organization website looking at their criteria for how they came up with that ranking for the United States 37. We're number one in responsiveness, but when you start to add in all the other things like public guarantees of access, we start to fall down. So the fact that we have the best results does not make us the best healthcare system. I don't know how that's possible.
Well, you know, Andrew, it's really too bad that this Commonwealth Fund report wasn't printed on toilet paper. Then it might actually be useful. You know, what can you say about this report? I mean, the fact you hit it right, the nail right on the head, you know, ranking Britain number 1. You know, have the authors of this report looked at what's going on in Britain? Give you one example. About a year ago, the heads of a number of the emergency departments there wrote to the National Health Service about toxic overcrowding in ERs. And you look at this Commonwealth Fund report, well, the UK ranks 4th best in terms of wait times in emergency rooms. I mean, it's absolutely ridiculous. You know, Britain's known for its long wait times for surgery and other types of care, but in this report they rely on surveys from patients and doctors, you know, which means relying on their memory, which, you know, can be unreliable. And the sort of funny thing here is in that section small section on wait times, there actually is no data in this report on Britain. Why? Because the sample size was too small. And then I'll just make one last point on this. It's not even clear that the wait time data in Britain is reliable. There was an article, a report in January, saying that 1 out of 4 hospitals there were manipulating their data, just a lot like our socialized healthcare system that we have under the Veterans Administration. You know, where have you heard that before? But of course, none of that data on you know, manipulating wait times is in this report as well. I mean, this report is just utter rubbish.
You're going to love this one. I actually went on the National Health Service website, and they have a news section. And on December 5th of last year, they had a headline referring to their, you ready for this? Cancer survival in Britain, the worst in Europe. And it says, and I quote, no joke, researchers say the main reason for low survival rates in the UK seems to be delayed diagnosis, underuse of successful treatments, and unequal access to treatment, particularly among elderly people. So if you make it through the wait time, they might actually deny you the treatment they know works. And that's what we want to bring here?
Yeah, well, of course, again, that particular bit of data didn't make it into this Commonwealth Fund report either. They do look at outcomes in this report, but, ironically enough, they always seem to choose, these types of reports always seem to choose outcomes that make the U.S. look bad. And most of them have one thing in common. That is, they actually don't tell you very much about the healthcare system. Let me give you one quick example from this report. It's called Mortality Amenable to Healthcare. Well, in fact, when you look at this particular statistic, what you find is it's impacted by a lot of things that the healthcare system has no control over, like a person's income, education, do they engage in risky behavior, and so forth. And what makes this report particularly disingenuous is two other researchers at the Commonwealth Fund not long ago published an article saying this statistic, mortality amenable to healthcare, you need to be very cautious when using it, in large part because of the factors I just mentioned. But what does the Commonwealth Fund do? Throw caution to the wind, use this statistic anyway because it makes the U.S. look bad.
It's amazing. I have a report I dug up from 1992, get this, from the National Center for Policy Analysis at Cato, and they had a wonderful quote on socialized medicine. Outside the United States, every country that has national health insurance rations health care through bureaucracies. It almost is never done through open, rational debate. Instead, politicians limit the budget of hospitals or of area health authorities and leave rationing decisions to the healthcare bureaucracy. Indeed, politicians almost never admit they're in any way responsible for the rationing. It seems like in many countries, the base of power for the government is its control of things that are in short supply.
Oh, absolutely, and politicians would never be directly responsible for the rationing because it would be a PR disaster, and if politicians put in policies that directly led to wait times, that is, that okay, we're going to have waiting lists for care, and that's going to be our policy, it would be a media nightmare, and they could, conceivably lose elections. So what they do is they limit the budgets, and they let the bureaucracy and the hospitals create the waiting times, and it actually works out very well for politicians because the number of people who are going to end up on a wait list is relatively small relative to the total number of voters, so it's not going to threaten them very much at election time. And because most of the people on the waiting lists are sick, they're not going to be engaging in protests and organizing and all the other stuff that can affect public policy. So the bad policy never changes, and that's really one of the big problems with any government-run healthcare system is the sick lose out because they have very little political power.
Don't you find it amazing, though, whether it's the World Health Organization or the Commonwealth Fund or any of these surveys that say we're the worst, they always put a silly weight on things like promises. So Cuba has a national constitutional promise of equal access for all, but their results are disastrous. But because they made that promise, they're so much more humane than, let's say, us. So you could put an empty promise into the Constitution that says everybody gets free health care. The fact that the results are awful, you still might be higher on the ranking.
Yeah, well, I'm not surprised. I mean, many of these institutions are populated by people from the political left. I mean, the Commonwealth Fund is definitely a left-leaning organization. So they're going to put in measures that make government-run systems look better and systems that rely more on the private sector like the U.S. Look worse. So that's really exactly what you would expect to find, from organizations that are dominated by the left and trying to make government-run health care look better.
All right, David, thank you so much for joining me tonight.